At first, I did not know it was TB. It started with a chest pain. Then I started using traditional medicine.
The hospital really helped us. Before we brought him here, he could not walk, talk, and had difficulty in breathing.
Nigeria is a high-burdened country for tuberculosis, also known as TB, drug-resistant TB, and HIV-associated TB. In 2014, Nigeria ranked 4th among 22 countries with highest incidence of TB in the world and 1st among countries in Africa with an estimated 570,000 new cases each year.
Tuberculosis is a chronic infectious disease that is caused by a bacteria or a bacterium we called Mycobacterium tuberculosis.
TB germs are spread mainly through the air when people who are sick with TB disease of the lungs cough, sneeze or spit. Facing the fight against TB in Nigeria are enormous, largely because cough is acceptable in the society. The other challenge is that awareness of the silent killer called TB is very low.
Once a Nigerian cough, the first thing in your mind, the health-seeking behavior is for you to possibly get a native, maybe kola nut to chew to suppress the cough. And if that fails, then you try to do self-medication by buying cough syrup. You might not be thinking about TB.
There are over 5,700 service delivery points that people can go. There is no single local government area in Nigeria that has no TB service delivery point. There are also over 1,700 diagnostic facilities across the country.
Nigeria, the most populous black nation in the world, is fighting an immense battle in silence as two deadly diseases, HIV/AIDS and tuberculosis, have joined forces to infect thousands of lives annually.
The most important confounding factor is HIV/AIDS. HIV/AIDS suppresses the body immunity, and the TB that maybe would have been there in your system for many years without doing anything would now spring up. And so we have more of TB cases among those who are living with HIV/AIDS.
Our objective is to actively detect TB cases. We want to diagnose TB and treat TB properly and make sure that we cure TB. TB patients will get free treatment in this country. We are committed to looking after them, and advice is that anybody with fever lasting more than 2 weeks, sweating, coughing, especially when you are coughing out blood, you should let us know. Or if you are losing weight, let us know. It might be TB.
The disease is treatable and curable. Alima Fashakin, AIT News, Abuja.